You're listening to Body by Poly. I'm Dr. Alain Polynice, here to share what I've learned over 25 years in breast and body surgery. Real talk, honest recovery, and the truth behind lasting results. Let's talk about the mommy breast, or what happens to your breast tissue after pregnancy and breastfeeding, and how to restore your breasts. So, what happens after breastfeeding? Obviously, with breastfeeding, the breasts engorge, they enlarge significantly. And after breastfeeding, there could be a significant loss of volume, but also overstretching of the skin and the ligaments that support the breast. And that creates drooping. So, there are three options in those situations. You could do a lift alone, a lift with an augmentation, such as an implant, or a lift with an auto-augmentation, which is basically using your own tissue. So if you have enough of your own breast tissue, then we can lift and reposition that tissue, just removing excess skin, but preserving all of the breast tissue. And a lift alone can restore the shape and fullness that you had before pregnancy. But after breastfeeding, very often there's loss of volume in the upper pole. So even with a lift, that may not be restored. So that's where an implant comes in. But fat transfer is a very popular procedure nowadays in my practice. So after doing the lift, I would harvest fat from different areas, such as the tummy, the flanks, the hips sometimes. The fat is then prepared in a special filter and then reinjected right under the skin where you normally would have fat. And that's a great way to restore volume in the upper pole, restore symmetry with the breast, and add volume in a natural way. So there's definitely options to restore your breasts after pregnancy, but you have to make sure that you are done with pregnancy, that you're done with breastfeeding. And now's the time to consider those options: lift alone, lift with implants, or lift with fat transfer. Very popular procedure these days.